Oh, shoot, we recorded. Welcome to another episode of Mind, Your Body and Soul, the Healthy Podcast. I am Joseph Ward, and as always, I'm joined by my homie,
Mathias Sweet.
Mathias Sweet. You see it with the no look two finger. What's going on? Hey, man, it's cold outside.
It is cold outside today. For some reason, I don't know why. I don't know why, but it's cold outside. But I'm loving it. I'm
I
enjoying
know
it.
you loving it. I'm over here freezing.
You
So,
over there freezing. No, you shouldn't be freezing.
so once again, welcome back. I am Joseph Ward. He's Mathias Sweet. We are your host for your favorite health podcast, Mind, Your Body, and Soul, the Healthy Podcast. And remember that Mind, Your Body, and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, mobilize our listeners to become the healthiest versions of themselves. So once again, we thank you for joining us for another episode. And we got a lot to get into. Not a lot, but we got a good topic to get into because this episode we're focusing on making the most of your healthcare visit. And we encourage you all to go back and listen to our last, or listen to or watch, however you consume this podcast. Listen to our last episode featuring Dr. Sharon Foster, who's the medical director for Neighborhood Medical Center. And we had a good informative conversation about what COVID is and the flu and how they both interact with the body, how they become body, and how we can prevent COVID and the flu. Mm-hmm. Also, housekeeping. For all our YouTube watchers, remember, like, comment, subscribe, and share. Because when you do that, YouTube got this magical thing where they got an algorithm. And if you subscribe, like, comment, and share, more people can see it. That's so magic. Oh, that's so magic. So make sure you do that. Everybody on our podcast platforms, whatever favorite podcast platform that you consume this through, whether it's our website, which is nmcpodcast.com. So make sure you visit our website at nmcpodcast.com. Remember, we're on anchor.fm, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and we got more and more coming. So y'all make sure you all check us out on all these platforms because we are getting it in. Ain't that right, Mathias?
You right.
Yeah. So today, like I said, today we're focusing on making the most of your healthcare visit. That's why we have our backgrounds that we have. I'm in the doctor's office, the office part, and he in the exam room.
Where it goes down at.
Where all the magic happens. But
that's it.
Like we say, focusing on making the most of your healthcare visit. Why? Because in the work that we do, we run across a lot of people who, when they go to the doctor, they really don't understand that you are in full control of your visit. You can literally dictate to a point what happens, what doesn't happen, what you accept, what you don't accept. And if part of our mission is to empower people with information, we want to continue to do that. So we're going to take this episode and make sure that people know ways to take care of to make the most of their healthcare visit. So let's go ahead and get this thing started. Start from the beginning. You like how that bounce in there? You see how that bounce in there?
I do.
That fancy. You put this together. You forgot you did it.
I know.
So Mathias, you want to start us off with this? Because I know you was one of the main ones saying that this topic needs to be had. So just start there. Why should people learn how to make the most of their healthcare visit?
Well, as y'all know, me and Joe work in the clinic, and we actually see this on a day-to-day basis. And we, all of our things are always to empower you to be your best self, to be your own advocate for yourself, because a lot of times people don't advocate for what they need in the healthcare system. They just, okay, that's it, okay, and go. But then you have 50,000 questions. And then people call me and Joe all the time after a doctor's visit sometimes, be like, well, what this mean? What that mean? This is where you should have talked to the provider at. That's what they're there for. Yeah, they have sometimes short periods of time that they can talk to you about. That's why it's important to have multiple visits back and forth. If you don't understand something, you need to make sure that you ask.
Right.
And like basically your healthcare team has the medical know-how. They know everything about your medical condition that you're going through. That lab work that they get, everything. You need to make sure that you know and you are comfortable with everything that you know before you leave that visit. So if you have lab questions or questions about your visit or a condition that they diagnosed you with, ask the questions until you feel comfortable and be like, okay, well, I still got questions. Ask. They will discuss and follow up things with you. They will take active role in your own healthcare, and we really want you to make sure that you're getting the most from each and every single visit. So that's what this presentation is about today, is so we can get you the most. So the questions you want to ask, what you need to find out, where you need to go, those are
Right.
what we're going to do today.
Right. You are not a pedestrian in your healthcare. Remember, you are the expert on you and your body. The doctor is the expert at this particular field, at a particular expertise that they have. You are the expert on you and your body and your life. So with that being said, you don't just go in there with the pedestrian mindset of, oh, well, whatever the doctor says, it just is. Like, you can't do that, because sometimes you will either not get things that you need, or you may get something that's harmful to you. So you got to speak up. And we do want to stress this. It's the job of the people in the healthcare field to help you help yourself. It's not our job to hold your hand and take you through it. So we do want to get people to understand that, because if let's say you become attached to, I use us as an example. You become attached to us and you expect us to do this and do that. Well, what if you come there one day and we don't work there no more? Are you just not going to get your services? No, you're going to get your services because we empower you to be able to do it yourself, whether we're around or not. So let's get into it. Click on this thing. So there we go. So as Mathias mentioned, there's a healthcare team. So in your mind, Mathias, and I know we'll go more into it on the next line, but just in your mind, what or who are part of the healthcare team?
The healthcare team is a very vague thing. So you have, when you go into a doctor's office, you have that person that answers the phone. That's part of your healthcare team. That's the person that connects you. That's the person that lets you know about copays, insurance, let you know when your next appointments are. Those are the very key people. Are your first people is your front desk people. Then you'll get into the back where you meet your medical assistants, your LPNs, your RNs. Those are all three medical professionals that are going to work with the nurse and the doctor, excuse me, the APRN and the doctor and the PAs to actually assist you in your medical care. Then you have your medical case managers, who are actually going to help you with referrals and other processes like that to help you get other care that they don't receive at that one particular facility. So there's some things that we're going to have to refer you out for to make sure that we can take care of your whole holistic approach of care. So we want you to understand that there'll be other things that we're going to send you for. It's not just when you come to the doctor, everything's taken care of right there at that one doctor's office. That's the only doctor you're going to see. So, and then you have your people like me and Joe, who are your health educators and your outreach people, who actually go out and do health education, who teaches the community about stuff like this, about what you need to know, like different disease things like diabetes, hypertension, HIV, STDs, any other, what else is there? Breast cancer, ovarian cancer, prostate cancer. I mean, we go into all these different things at different events. So that's why it's important to get to know who's all in your community and what your community health centers can help you with. So that's basically what your healthcare team, and then you have your providers, your doctors. Those are the ones who treat you.
Right.
So those are basically the steps of making sure that these are the people you're going to come in contact with.
And then I want to add to that, transportation.
Yeah.
For a lot of people, transportation is a big part of their healthcare team. So those of us who drive or have our own vehicles, we don't think about somebody in transportation or somebody who can transport us being part of our healthcare team. Could be a family member, could be a taxi, could be Uber, could be the bus, whatever, wherever you live, transportation, you might want to think about that depending on the dynamics that you have in your life. Also, family members, accountability people, support people, people who you can lean on and talk to. All those aspects go into your healthcare team. So we'll just do, and we have an actual list here. So for those who are listening won't be able to see this visually, the healthcare team may include doctors, physician assistants, nurse practitioners, nurses or medical assistants, pharmacists, dentists and dental hygienists, mental health providers, medical case managers, and as I said, people who are in transportation, family members, friends, and the list could extend depending on your circumstances or your specific needs. So when we talk about a team, remember, like on a team, everybody doesn't do the same thing. Because if everybody trying to do the same thing on the team don't win. So everybody on the team needs specific roles. And once everybody have clear defined roles and there's clear communication going on, that will help you as the person who's seeking healthcare be able to get the most out of your care. If you have rapport with your doctors, I know like everybody who comes and works with us, one of the main things we stress is you have to build rapport with the clients or the patients that you see on a regular basis. Like if you don't have rapport with the people you're dealing with, they're not gonna feel comfortable. Like everybody doesn't go into the doctor's office just, all right, well, you the doctor, do your thing. Some people not, who are you, where you come from, all these things. So even on the medical side, if you're a medical care provider and you're listening to this, how are you building rapport with the people that you are serving?
Right.
And for the patients, how are you building rapport with the medical providers? Are you mandating that rapport is established? You need to be able to do that. You go to the pharmacist. You need to make sure you have open communication with the pharmacist or any pharmacy that you go to, so you can understand what's going on. Because like we had with Dr. Brianna Jernan and Dr. Danielle Williams, they talk to you. They're the most accessible. They'll talk to you. They'll teach you different things. So your medical team, your healthcare team is very, 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 very important to you. You know what I'm saying? So,
I mean, that is important to make sure. And sometimes we look at people to be your healthcare provider. Your medical team is the people here to help you. And if you don't open up and tell us what's going on, we can't fix the problems that you're having.
Right.
So it's important that you get to know them. These people are here for a long haul. They're not somebody that's here today, gone tomorrow. So if you do find a doctor, and it's a lot of times people go to the doctor and be like, I'm just not comfortable with this doctor. I want a different doctor.
Right.
That's okay. Go to another doctor. Find another doctor in that facility or in that practice. But it is okay to go and say, you know what? I don't like this doctor. I don't like the way they talk to me. Because you want to be able to feel comfortable and knowing that you're asking the questions and you're going to get a respectable answer.
Right, right. So, like you said, it's empowerment at its fullest. It's empowerment at its highest, because you are not just a pedestrian. I'm gonna keep stressing that you're not just a pedestrian. This is not some fly-by-night stuff. This is your health. This is your life. And if you want the highest quality of life for as long as possible, you have to make sure you're taking an active role in your healthcare.
And you actually really need to make sure, don't go in there with them attitudes that some people have and you went on Dr. Google and everything else. Let the people do what they're supposed to do and say the things that they need to say. But don't go in there where I read on Google and this is what I'm going to do. Don't always go to Dr. Google. They tell you to stay off those different sites. But ask the medical professionals. And then if you don't feel comfortable, you can always seek second opinions on things when they give you certain diagnoses. But make sure that you talk to them and get to know them. And that's the main key we want you to know, is get to know them. They're people too. They're not just somebody that's just out here to be like, hey, I'm here.
Right. And if you don't feel comfortable within the medical setting that you're in, there are plenty of other medical settings. Mm-hmm. But now, so the mindset or the change here is, how can you as the patient help your healthcare team?
That's easy. You need to go to all your visits.
Right.
Don't be like, oh, I'm gonna go and then don't go. Right. Follow your provider's instructions / their plan of care. Like if the provider tells you to take 10 pills for the next 1 pill for the next 10 days, take the 1 pill for the next 10 days. Don't say, oh, I feel better, it's gone away, and I'm not taking it no more. Because the reason they want you to take that kind of stuff is because Once you feel that the need, you can build a resistance to that antibiotic or to that medicine if you don't finish out the treatment itself,
Right.
the instructions.
Right.
Um,
And they also need to understand that they are a part of creating that healthcare plan as well. It's not just the doctors giving them a plan. It's a concise plan that you and your healthcare provider got together and created.
And also, one big key thing is, and we stress to all of our patients, we see primary care. Sometimes we do, depending on the provider you see here, you might see an infectious disease provider and things like that. But if you're seeking other doctors, say you have a chronic illness and you're going to a specialist, make sure that your primary care doctor knows what's going on at your specialist. Make sure that if you have if you're being seen here just for primary care and going somewhere else for HIV care, make sure those two providers are linked together to know, because there are different things that can counteract with medications and things that could go wrong with one care versus the other care. So make sure that you keep all your providers in the loop. You also want to keep a current list of your medications, because that's important. A lot of times we go to the doctor and be like, I'm taking that blood pressure pill. But what's the name of it? What's the dosage of it? I don't know. Yeah. It's a little blue pill. You know how many little blue pills are in the pharmacy?
That's
so we want you to make sure you keep the actual active list of your current medications with you. Write it down, put it in your wallet, put it in your purses. You know what? Better yet, put it in your cell phone.
Yeah.
Because it's always with you.
Please do not just be out here just allowing people to give you medicines and you just taking it because they're in the medical field and you're not even asking questions. Because we do meet too many people who don't know the name of their medicines. And all they know is somebody told me it does this or somebody told me it does that. But even as well, not knowing the medicines that you're taking and not knowing the doctor that you're seeing or not knowing the provider that you're seeing, you're just out there just swimming and you have no direction. And the thing is, we should be creating a health care direction that people are going. You either working to get better, or you're not working and you can get worse. But that has to be some kind of direction. So that's why we want to stress to people: if you go to a doctor, what's your doctor's name? Because we get calls all the time. Hey, this doctor told me this. Well, what's your doctor name? I don't know. Short, skinny lady. Well, what if
what you saying?
That could be anybody. I mean, of course, we know the people within our practice, but that could be anybody. So make sure you know your medicines, know your provider, know who you're talking to, write names down, keep a log of everything you're doing.
And we really take people and we really charge everybody to take an active role in their healthcare, because you only got one life.
Right.
We only got one life. We get many chances in this life, but we only got one life, and we got to take care of our health, because when our health goes down, we start going down. Right. And we really don't. A lot of people don't have a primary care physician, and most men are susceptible to this as well. We don't go until something is really, really wrong. Some women do the same thing, but we really want people to understand, go ahead and get that established care, because when you get that established care, things fall into place. When you're sick, you can pick up the phone and call and say, hey, I'm an established patient here. I'm not feeling too well. Can I come in for a visit? Or, a lot of people just go to the ER, and that's their doctor is the ER. But you're not getting that continuous care. You go to the ER, they set you to go to a primary care. They set you to go to Neighborhood, CarePoint, Bond, the health department, some other private entities, but you never show up to those appointments. So then you fall back in a few months, the same issues going on, or you need that medication refill, and you go right back to the ER. So you got to stop using the ER as your primary care. The ER is for emergency care only.
Right.
And that's what we're trying to get everybody to. Take your own care and get a healthcare provider.
Yeah, you cannot be successful as far as health with the emergency room as your doctor. Also, I think for society, it's time for us to change these narratives when it comes to men in work, because that affects healthcare. So you can't. As a man, I'm a provider. So if my mind is constantly on providing, I'm not going to take the time to take care of myself. I'm not going to take the time to slow down a bit especially if I feel like the world is on my shoulders. And as a man, I have to do this, I have to do this, I have to do this, I have to do this. So I do think we need to take another approach to how we socialize men as far as being providers, because that is affecting our healthcare.
But Joe, the one thing I like about 2020 is, and you know I don't like too many things about 2020 right now.
It made everybody slow down.
It made everybody slow down, but all healthcare providers are doing telehealth.
Yeah.
So there's no reason for you not to sit down and take a 15-minute break to sit down and talk to your provider and have a full visit and get everything you need in 15 minutes over the phone or on a video chat.
Okay, well, hold on now. Let's make sure folk understand telehealth.
Okay.
What's telehealth?
Telehealth is where the provider and the patient see each other via the computer screen, or how we're doing now. Or they can even talk to you over the phone and provide you with those services over the phone. The provider could be in one location, you could be in another location. They can see everything that's going on. It's a secure, safe way for people to see that I can go to my doctor and be right here in the comfort of my own home and don't have to leave, but I'm still working from home.
Right.
So it's no excuse right now in this pandemic for people to say, I can't go to the doctor. I can't make a way to get to the doctor. You can take copays over the phone. They can do everything you need over the phone. They could even bill you later for the copay. But you can see that provider and get all your visits and everything you need right from the comforts of your own home. Right. Or guess what? Most of y'all have an office and say, I'm too busy. Take that 15-minute break and close that door and log on to your doctor and have your 15, 20-minute visit.
And you in there.
And you in there like swim well.
There you go. So I'm glad I wanted you to explain that, just so people won't just hear it, but they have a greater understanding of what telehealth is. You don't have to leave the comfort of your home. You can see your doctor virtually or talk to your doctor over the phone and still have those visits and make everything happen. So
now, there's one thing about telehealth I want people to know. If you do have like high blood pressure, uncontrolled blood pressure, high diabetes, uncontrolled diabetes and things like that, some of those visits you might have to come into the office for, but there's a few of them that you can do at your home. You know what I'm saying? You can still check your blood pressure, because if you have uncontrolled blood pressure, you should have a blood pressure cuff that your provider has prescribed to you, so you can take your blood pressure. You should have a blood sugar machine so you can check your blood sugar. So some of those things could be out of the way for you, but you can still make them work at home because you have the access to it. So don't think that, oh, I have high blood pressure, I still need to go into the office. Yes, you might need to go into the office sometime, but some of the visits can be done over the phone and through the computer screen. So there's ways around it.
So this next slide is saying, what does the healthcare team do? And so the caption is, the healthcare team is there to help you achieve and maintain your optimal physical and mental health. Right. So we're helping you help yourself be healthy. So once again, it's not the healthcare team's job to make you healthy or hold your hand through your journey to health. It's to be there to help you reach your goals. And remember, that's why I talked about the provider and the patient getting together to create a healthcare plan. Because if you're a provider and you're creating a plan for somebody and they're not involved in the plan, you're not really helping them. You're not really helping them. So the provider, the patient got together, bam, created a plan, and then this is what we're doing moving forward. So that way the people who are part of your healthcare team can know where they fall in, because we actually have a plan. So do I need to be the person who encourages you to take your medicines on a regular basis? Am I the driver, the one who's going to get you to your appointments? If so, I need to make sure I'm on time. You know, if I'm the provider, am I scheduled correctly? Am I making sure I'm seeing my clients? Am I there on time? All those different things. If I'm the pharmacist, when this person comes in, have I even taken the time to get to have a sense of familiarity with the people that I see on a regular basis? I mean, some pharmacists, they may see a whole bunch of people. I'm not saying you got to remember everybody, but what form of familiarity do you have with at least the people that you can see on a regular basis, or familiarity with the medicines and everything that works with the clients or with the patients rather? So for me, when I'm thinking about the healthcare team, it's all of the people who have signed up to help you, and they're going to be consistent. They're accountability partners, all those things.
Mm-hmm.
But the most important component is the patient.
Mm-hmm. Because without the patient, there is no healthcare.
Right.
I mean, literally, if we come up with a plan and everything, but the patient's not there, but all the respectable parties are there, how are we really helping you?
We
We
not.
have the plan, we there, but you're not utilizing your resources. And I think that's a lot of times people go back to with insurance. You always buy the most expensive plan for the insurance, but you never use it.
but
So
you have it just in case you may need it.
right. So I mean, go ahead and go to that doctor and just do that just in case. But if you don't go but once a year just to get a physical and a checkup, you need to do something to make sure you're established in care, because a lot of these diseases out here are silent killers.
Yeah.
Like you might feel fine. You might be like, oh, I got a headache today. It could be high blood pressure. It could be something else going on. Don't always just assume, oh, it's something I ate or this or that. Sometimes things could be wrong, and your body lets you know when something's going on. We just don't look at the signs.
Remember that time we was doing testing? I forgot exactly where we was, but that don't matter. Well, we were doing testing. We ran across the man. It was a grown man who his blood pressure was high. We did the blood pressure on him, and his jump was through the roof. And he was like, "Man, I could do 50 push-ups right now." And it's like, and he was starting to try to motion to get down on the ground and do 50 push-ups. And we like, no, you're not finna do 50 push-ups because you could fall out right here because this is indicating that your blood pressure is high. Once again, I know for us as men, if it don't hurt too bad, we don't do it, and we're always on the go. So we have to be able to slow that down and not think that I can out muscle everything. So nobody's exempt from healthcare issues if you're not taking care of yourself. If you're taking care of yourself, it will reduce them. It will prevent them. So
right.
So taking an active role in your own healthcare, because that's one of the main focuses. That's what we're here for. So being prepared for your healthcare visits. How do you normally prepare for your healthcare visits? Like Mathias, what would you do to prepare to go to the doctor?
Well, the first thing I would do was make sure I know my appointment date and time, because we get a lot of that too. Oh, I got an appointment today, but I don't know what time. Make sure you know your appointment date and time. Know how you're going to get there. Make sure that you're on time. Be prepared. When you go there, that's like almost like an interview. Be prepared. Have questions.
Yeah.
Want to know what's going on. If you're say I'm coming in for an STD panel and a physical, and I did all my blood work already. I want to know everything that I need to know what's going on with me. So have questions prepared. Make sure you ask questions, even though you might have them prepared. Some people are scared to ask the provider sometimes. I don't really feel comfortable asking, is it okay if I ask these questions? No, ask the questions.
Ask the question, yes. You paying for it. Ask it.
Be open and honest with your healthcare team. That's a main question. If we ask you a question because your lab work shows something, that's like when me and Joe are doing testing. It's important for you to be open and honest, because when we ask you certain questions, it leads our mind as trained professionals to go to another level and say, boom, let me ask this question because this might spark something. And hey, I need to tell this provider you need to test for this, this, and this, and this. So making sure that you be open and honest and telling your provider what's going on. Tell us how you really feel. Don't say, oh, I just got like a little small pain. Oh, okay, but it's really when I lay down at night, I got this big throbbing pain in my chest. So we really want you to make sure that you go in there with an open mind and be open and honest with your healthcare provider. Take part in making decisions. Ask the provider, is there anything I can do besides getting on a pill? Is there something else I can do or try, or something else? Or can we try this for a little bit and then go here? And always want to ask those questions and follow up with your plan of care. Make sure that if you said, when you leave there and say, I got an appointment in 3 months, make sure you follow up with that. Or if the provider tells you, I need you to exercise 3 times a day, I need you to lower your salt intake, I need you to make sure you drink more water. Everybody should be, me and Joe always do it. Water. So if the provider is telling you to do certain things, follow those plans. And we're not telling you to make everything, and it's not going to be easy. Let me tell you, because when you go into a doctor's office, and they tell you you got to change your whole way of life or your whole eating habits. It's difficult, and we know it's a process. But guess what? We try at that process, and that's what we want people to understand. It's like, let's try. Give it
Yeah.
that old college try that he holds. Let's just go for it, because you don't know if you can do it. Don't say you can't do it until you put your mind to it, because you can do it. You got to
Right.
be able to try and want to do it.
Right.
And
So
trust me,
yeah,
when these things happen, you're gonna want to do it.
because prevention, going back to that, what are you doing on a regular basis? Because that's another way you can take an active role in your own healthcare is, like you said, if your provider say, hey, well, I need you to exercise 3 times a week. Like me, I know nobody's told me that, but I know I need to exercise more. So it's what's the best way or the most convenient or the greatest way I can incorporate exercise into my daily routine. So A, I don't quit, and B, I get the best results from what I'm doing. And I don't make it boring. I don't make it like a task or something like, oh man, I got to go work out today. Like nobody want to do that. So how can I incorporate this within my regular routine to make it something that's enjoyable, but also me understanding long term that this will help me live longer. Because Matthias, you know how we'll make the jokes that, hey, vegans, like people compare vegans and crackheads, like crackheads live long too. And it's like, yeah, but the whole thing is the quality of life. So we don't want people to be 60, 70, and 80, and the quality of life isn't great. They're unhealthy. So you want to be 60, 70, 80 when you're and healthy and being able to move around, being able to have full usage of your limbs and all the faculties of your body. But that starts now. That starts with creating these routines and taking this active role in your healthcare and really understanding what's going on, asking questions, having pushback on certain things if need to, just doing everything you need to do to be the healthiest version of yourself. Because if you don't, you will have the complications down the line.
Mm-hmm.
So, and this is more continuation on being prepared for your healthcare visit. So, like you said, asking questions, realizing or finding out what you're going to get from your visit, or how are you going to get to and from your visit, right? Is there anything that you need to tell your healthcare providers? So, like, do not, trust me, please do not be withholding information. We, as providers should not be like working in the dark, just trying to figure out what's going on with you. They should know, they have a clear map. You know, I can get to Atlanta quicker if I got a map rather than me just out there just aimlessly walking.
You're right. You're right.
So doing that, like another thing, like when people with their labs, when they need to get their labs done, like go get your labs ASAP. Like really go
Mm-hmm.
get your labs. Like literally, I went in, I had to go get some labs last week. It really didn't take long. The part that took the longest was it was other people ahead of me. But once I got in there, the lady put the thing in my arm, took the blood. I didn't even feel her put the thing in or take it out. She did that. I'm in and I'm out. It didn't take long. It was painless. It was seamless. Now,
Joe,
mm-hmm.
tell them why it's important to get that lab work though.
Okay, because if you don't get that lab work, you might not get seen by the provider. And the provider have no clue of what's going on with you. I don't know how to help you if I don't have your labs. I don't know where to start. I don't know what needs improvement on. I don't need none of that. But also, you might not get seen that day if you don't have your labs.
Because the lab work is more like the blueprint of what's going on.
Right.
So, take it like a contractor. They have to have that blueprint on how to put the wall up here, where to put the light fixture, where to put this. The blueprint of their labs is like a blueprint. It tells the
Yep.
provider what's going on in your body, what levels are good, what's going on with your kidneys, your heart, all these different things the providers can read from the blood work. So that's their map and their guide to keeping you healthy. So that's why it's important to get your blood work. Please don't mess around when the provider says, I need you to get blood work and come back in 2 weeks. And then in 2 weeks, you come back and be like, oh, I still didn't get the blood work. I was too busy.
Right. I mean, and one thing about that too is there are some people who are legit busy. Like their life, just the way their life is constructed, they don't have the same time everybody else has. But even those people find a way to get it done.
Mm-hmm.
And then we have some people who just move when they want to move. And if you are that person who moves when you just want to move, you're not helping your healthcare team. You're really letting your team down.
Mm-hmm.
Every component of the team is important, including the person who the team is constructed around. So you got to understand that if they tell you go get your labs within a couple of days, go get your labs. Because if you got 2 weeks from when you go get your labs to your next appointment, you want to make sure that your labs come back. So when you go to your appointment, you can actually be seen in the appointment and you can move forward with improving your health. So get there, ask questions, do that. Now, there are some people who have anxiety about needles and blood and all those things there. And that's why the people at the labs are trained professionals. That's what they signed up to do. So you should be okay. But at any point, if you don't feel uncomfortable, speak up and speak out. So anything you want to add to that? You muted.
Make sure you have questions about your healthcare. Just don't be afraid to ask those questions. Your healthcare provider team is here to work for you. Because without you, there's no paycheck. If we don't have patients, we don't have a paycheck.
Right.
So we need you like y'all need us.
Right.
So it's a teamwork approach. So if I'm here and you're not here and you're here, we're connected. We become one. It can work. But one can't work without the other. So we really want to make sure that ask those questions. Don't be afraid to get to know people. Please get to know your healthcare providers.
Right. What Big Mama said on Soul Food, them fingers, when they by themselves, that's junk. But you make that fist, you can make a mighty blow.
Yep, that's
what
right.
we're doing. We're making that mighty blow. All right. So ask questions, ask questions, ask questions, ask questions, ask questions. Like ask questions. If your provider get tired of you asking questions, ask some more questions. So because it's imperative, it's important. It's your health that's on the line. If you don't understand, then it's the provider's job to help you understand, to take the time to give you the information in a way that's digestible for you, to give you the information in a way that you can not only digest, but be able to utilize to help yourself. Because like to say, knowledge is power. Well, that's not true. Knowledge applied, knowledge taken in, understood, and applied is what makes people powerful, right? So ask a question and then make sure you understand the answer. Well, if you ask question A and they give you answer B, only way for me to get to C is to understand that. So if the doctor or the provider is saying something to you that you have no idea what they're saying, you have no idea, no point of relevance, how to connect that to be able to use to improve your health, continue to ask questions, continue to talk, continue to query the provider. Because if you don't understand what's going on, we've had clients, and I've known people who they are prescribed a specific medicine, and they either don't read the label, or they misread the label, or they just go off what somebody tells them. So it could say take 2 pills a day, and so this person is like taking 2 pills an hour. So twice a day they taking 2 pills. No, that's 4 pills a day. Well, no, now you overdosing yourself. So instead of, you didn't understand, I need to only take 2 pills a day.
Mm-hmm.
So if you don't understand, you could compromise your health even further.
Right. And so, like, take that what Joe's saying, for instance. If you have a health, a literacy problem where you can't read, or you have a comprehension problem and don't understand, make sure that you have somebody there that can assist you, because it's very important. Or if we need to write things down, but if we write it down, you can't read, you got to let us know so we know to come up with other ways to help you, making sure that you take the medication. We can put stuff in bubble packs for you where it just says day 1, day 1, part 2. So, you know what I'm saying? We need to make sure we can come up with different ways for you to make sure so you don't overdose. Because you could put yourself in a real pickle if you take too many of certain medications. It could bottom your blood pressure out, your blood sugar could go real low. And if you don't know how to, if you don't comprehend or can't read, please let us know, because we can assist you with a lot of different things to help you, because we want to help you. That's our goal. Right. And making sure that you ask and let us know, because you come in the office, you look like you're a well put together person, but you can't read. I don't know that you can't read.
We've seen
that. It seem like you know how to read, and I'm like, you saying, yes, I understand. But then when you get home and you're looking at these different bottles and you're like, I don't know what to take.
Yeah.
So we really want you to make sure that you stress that. Be open and honest with us. We're not going to shame you because you don't know how to read. They're not going to say, you know what, you should know how to read. Why don't you know how to read? We're not going to do that. We're going to help you.
So, I mean, it's not our business why you don't know how to read.
Right.
It's our business to help make sure that you understand what we're telling you and you know how to use that information. If you're trying to, if you shouldn't even be a part of somebody's healthcare team if you're going all, well, why you should know how to read. How you gonna take your if the person that made it this long without knowing how to read, obviously they have some sense of intelligence.
Something's working.
So how can I give this person this information so they can understand?
That's right. And
that should be the next thought.
That is important to make sure. And that's why, because we can get you something called an advocate, someone who can help you with your appointments, help you get on a schedule. We can actually call and say, hey, Mr. Ward, did you remember to take that little blue pill that's in that package that starts with the L? Did you remember to take that pill? We can assist you with those things, but we need to know how we need to assist you.
Right.
What works better for you? Is it better with pictures? Is it better with words? I mean, help us. Is it better to send you a text message? Say, hey, pill time, or set reminders on your phone to say, hey, take this, and have the word written out on the reminder that we can set in your phone. So, like, those are the different things that we need to come up with to figure out what we can do to assist you.
But because, like, reality, being realistic, there are people who are illiterate who are on social media. So if they navigate the social media, then they can navigate the health field. We just have to make sure those of us who are on the healthcare team, make sure we understand what's going on, and we don't be too big for our britches. I don't think we should be, forget all that. Meeting people where they are and helping them get to where they want to be. Now,
go ahead.
Now I'm just gonna say, now, if a person doesn't have the mindset to improve their health, then the whole team won't work. But if that person has the mindset, then those are part of the team. We need to make sure we're doing our part to make sure we help the people.
Also, and it's not even about learning how to read. What if you have a patient who, you know what I'm saying, we're getting older. The generation that was young once now is getting older. You know what I'm saying? We're approaching different things. We might have memory loss. It could be a condition that comes up. But if you're not telling us, oh, I'm forgetting things, or I'm forgetting this, or I'm, you know what I'm saying, or I can't remember, those go into play as well. So we really want you to understand that those type of diagnoses that you might not be diagnosed with yet, with memory loss, or, you know what I'm saying, or folks say that forgetfulness and things like that, you got to make sure that there's somebody there to help you with reminding you to take stuff, because, you know, your busy day schedule, sometimes I even do it if I take any medication or something, if I'm on an antibiotic, did I take that pill today? Did I remember to take it? And then you don't know, and you got to go back and try to count the pills to make sure you know that, hey, okay, yeah, I did take it. But those are the things we're trying to help, prevent, because we don't want you not to do something.
I be like that on that CMOS sometimes. I got to take that CMOS.
I don't see how you don't forget you took that, because horrible.
But see, but that's the thing though, as a pungent of a taste that it has, the way we construct our lives, being late, just rushing, waking up late, rushing. Sometimes waking up 10 minutes late could make you rush through your whole day and you don't do certain things that you planned on doing. That's why sometimes having things in certain places. So you can have backup medicines in your purse or your wallet or in your car or at your job, certain places, so you can remember that you can take all the medicines that you need. So, but it all coming down to back to this slide though. Make sure you ask all the questions that you need. And if somebody got a problem answering your questions, find somebody else to be able to take care of you. So, and we just went over this, but I'll say these just so give you guys an example of some questions that you can ask. So like the first one is asking, how often do I need to see you? And that's going to be dependent upon your health evaluation. Everybody's not going to need to be seen at the same time or the same frequency. So you have to ask that question. Well, when's the next time I need to come in? And when's the next time this? And when's the next time that? Like when I went to the doctor the other day, I went in and I gave them my history, and I was like, well, and I need to be referred to do this because this is family history, and they did. So like that's the next one. What test do I need? That's a good question to ask.
It is. What can I expect from the results of the test? So like know your pros and cons. You always want to say, we always think everything needs to be good. But what if it's wrong? What are the things I'm facing if it is wrong or if it comes out abnormal? What can I do to change that? Or is there a thing I can go back and change it? Is there a way I can reverse the effects? Ask those questions. What are my treatment options? There's always things other than pills that you can do for certain things. Making sure that which one do they recommend? Sometimes, now this is where you get into your research, where you can do your research. Not going on but just Googling the medication, seeing what it is. But guess what? If you ask that provider, what are the side effects? What's going on with it? What can they do? The provider will know and be able to tell you and give you information. If they're giving you medication, they should be able to give you an informational handout about that medication.
Straight up.
Like I said, that goes into the next thing. Like, what are the side effects? What should I expect from the medication? Sometimes medication has side effects that you have to, that are small, mild side effects that you go through that disappear after you get into the medication and after you get into the regimen and taking it. So some things, sometimes it might make you feel sick. Guess what? You might need to eat with it. So it's important of knowing what I need to do with this medication, how I need to take the medication. Will the medication interact with other medications?
Right.
What's the best time to take it? Should I take it in the morning? Should I take it in the afternoon? Should I take it at night? And what can I do to make myself better?
Right.
So that's the things you need to ask the providers itself.
It don't seem like everything you can't take. If you're taking St. John's wort, you can't take nothing else, huh? That's what it seems
right.
like.
But it's very important that you tell the provider as well what over-the-counter medicine you're taking. If you're taking vitamins, don't think, I'm taking vitamins, I'm being healthy. Sometimes that medicine will, like he said, that St. John's wort, it says if you're taking it, you see it on the commercials. So it's not nothing that's, they're hiding, but it's something that's in that medication that preventing other things from working. And saying it's not going to make you have bad side effects, but it could be just something that just lowers the efficacy of the medication. So it may not be at its full potential where they want it to be.
There you go.
But there's other things you can take out there. There's other supplements and things like that. But make sure you talk with your provider about some of those supplements because all supplements aren't good for you.
Right. So just make sure you are doing that and taking care of that. But also a little more clarity with that too. There's some people who are taking supplements and different health things, putting in their body. Still communicate that, but the majority of it comes when you are when they're prescribing medicines for you to take. So they're prescribing medicines for you to take. You need, hey, I'm on this sea moss. Take this sea moss every morning. You know, so they'll understand. All right, well, buddy, on this CMOS, let's make sure we are doing what we need to do. You might need to get off to take this, all these different things there. So,
or they can order you a different medication that works with the CMOS.
Right.
So there's other, just because they put you on a blood pressure medicine doesn't mean there's only one blood pressure medicine and that's it. There's other medications that they can put you on to work with what you're on. That's why it's important to discuss exactly what you're taking, so we know.
Right. So there it is. So we talked about this. In this slide, we talked about this with Dr. Danielle Williams, talked about this with Dr. Brianna Journay. But working with the pharmacists, they are experts on medicines, right? So they know the medicines, you know you.
Mm-hmm.
And pharmacists are great people to talk to if you don't know the name of the medicine and you don't really understand fully what the medicine does. Because pharmacists would know more than the providers prescribing the medicines. So you go to the pharmacist and you see Dr. Danielle Williams and you say, hey, doc, well, what is this? She's going to take the time to make sure you understand what's going on. She's going to take time to make sure you really know how this medicine can help or hurt you, how many times you need to take it, how to even pronounce it. Because some of the, they 17-letter word medicines, I get it. Like, what is this going to do to me? So, but that's why going to the pharmacist, like she said, pharmacists are some of the most, or maybe the most accessible healthcare providers. So go to your local pharmacy. Can you help me understand what this is? Can you explain this to me? Can you help me pronounce it? Those things. Don't be afraid to say, I don't know. In the medical field, we know you don't know. We still learning. That's why they call it a practice, because people still learning. So we know you don't know, but we want you to know. And that's why we do things like this, because we want people to know. But if you come across people and you are asking questions you want to know and they not telling you, go find somebody else, because they're not providers for you.
And also, when you go to that pharmacy, you don't have to be picking up a prescription to stop and ask a question. You can always stop and ask the questions like, hey, I just need a little clarity. And when you go pick up that prescription and you sign on that pen pad, it says on there, do you need to discuss anything with the pharmacist? You can click yes. The pharmacist will stop what they're doing in the back and come up there and discuss the medication with you. Don't think you're burdening anybody by just saying, I got questions or asking questions. Don't ever think that there is never a dumb question when it comes to your health.
There you go. So, and they just continue working with pharmacists. Just reiterating, if you tell people what's going on with you, they can help you the best. Just don't hold back any information that's pertinent to you becoming healthy. So your pharmacists and your providers, everybody on your healthcare team need to know everything about you so we can best help you.
That's right.
Oh, and these are we're gonna go over these real quick. We want to say them out, especially for those who are listening. If you're watching this, then just bear with us. But those who will be listening to this, these are questions that you should ask your pharmacist. And the first is, what does this medicine do? Great question. They should be able to tell you medicine does this, 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 and this, and this, and this, and this. How and when should I take this medicine is the next question. Another great question. What should I do if I miss a dose? Which is an excellent question, because it happens sometimes. Sometimes people miss a dose. Don't beat yourself up. Don't think the world is over or you're a bad person because you missed a dose. You missed a dose. But if I do miss a dose, Mr. or Miss Pharmacist, what can I do? What should I do? What side effects should I expect? That's a great question. That should be one of the top questions you ask, because certain medicines do have certain side effects. Matter of fact, all things have side effects, and the side effects could be either good or bad, but you need to know what the side effects are. Is it helping me improve? Is it going to suppress appetite? It's going to give me a little rumblings in the stomach. It'll make me go use the bathroom. All those things you should know. You should be asking, what side effects should I expect? Does this medicine replace something else I'm taking? It may not. Now, you can't make that decision just based off of, well, I feel like this and I feel like that. That's why you talk to your pharmacist. Are there any special directions for using this medicine? Please read the bottle. Any packaging, any information, the paper that comes with your medicine, read it. Read all of it. Same like in every aspect of life, you should be reading all the instructions, but especially with that medicine that you're putting in your mouth, even if it come with that little thick packet that be glued to the bottom, rip that off, open that thing up, and read it. Like really sit down and read it. People like, well, I don't have time to read. Well, that means you don't have time to be healthy. This medicine looks different that last time. Is it the right one? That's the great question. Because medicines do change, medicines do evolve. Like us, we work in the HIV field. So we can have somebody who come in this week who's still taking 5 pills because they're on some older regimen. And we can say, hey, well, we got these 1 pill regimens that you can take. We're going to need to explain that to that person that they're going from 5 pills to 1, and they want to make sure that they stay virally suppressed or healthy. We got some explaining to do.
You're right. But even though with that right there, when they ask that question, the medicine looks different than the last time. You got to remember, when we order medication, it comes from manufacturers. Yep. So we might not be able to get a medication from a certain manufacturer this time. So that one little blue pill you used to take that was blue might be white this time, or could be pink, or could be yellow. So it's not, nothing's changing the medication. It's just the manufacturer. So everything looks different from different manufacturers. So it's okay to ask them questions because that's showing that you're taking responsibility. Like, hey, this normally don't look like what I take. Am I taking, did you put the right thing in here? It's okay to question the pharmacist, but that pharmacist is there to make sure. Think of it as like this. Your healthcare provider is your first line. Your second line to make sure that you don't have any allergies or anything counter interact with any other medications is that pharmacist. They work hand in hand because guess what? It goes through the doctors, trained people, and goes through the doctor and the nurses and everybody. Then it gets to the pharmacist and they're double checking again. That's why they say, do you have any allergies? Do you have anything going on? Anything else? They can look at your whole medication history. It's important to make sure you pick up your medicine from the same pharmacy. Don't be going to, I got this prescription going over here, or I got this one going over here. Only time you do that is when you do specialty meds, when certain pharmacies can't get certain medications in because it's a specialty med. That's okay. But if you're going to get my blood pressure medicine from this one, I'm getting my diabetes medicine from this one, we got to make sure that they talk co in hand. So they know, so we know what's going on.
There you go. So ask them questions. Like I said before, ask as many questions as you want. If somebody got a problem answering your questions, find a new provider. They need you just like you need them.
That's right.
Dentist. Like that's another part of the healthcare team that I think people do forget is the dentist. How, being open and honest with your dentist. How are you taking care of your oral health? Are you doing the things that you need to do? What's your history of it? Have you had any cavities? Got any teeth pulled? Had to get any tonsils pulled out? All that, anything that happened with your mouth. What's going on? Are you a person who you don't like the way your breath smells? You want to whiten your teeth. You want to change your smile. You want to get braces. All those different things that you may want cosmetically or even on the health side. You got to talk to your dentist just like you talk to your provider or your pharmacist. Y'all probably ain't think we're going to throw the dentist up in here. Yeah, the dentist part of your healthcare team too. Mind, body, and soul.
That's right. If they looked at our healthy happy hour when we had Dr. Butler on there, you look at the thing. The mouth tells you a lot of things, what's going on with your body as well. Yeah. And you'll be surprised at what a dentist can see, what health conditions you have from your mouth.
From the color of your tongue.
You can get everything in your mouth that you can get in your body. And people don't understand that. Like sometimes, like we learned on one of the healthy happy hours, Joe, that some of the odors that if you have bad breath, that's because something else is going on. It's not nothing on in your teeth, it's something going on in your body. Yep. And so that's why they go hand in hand as well. And that's what I like about Neighborhood Medical Center. We have everything at hand together. We have dentists, we have the healthcare professionals for the mental health, for the primary care, the infectious disease. We're all in one office that we're able to talk to. Hey, I noticed this person had a strange odor when he came in to get his dental work. So the hygienist and the assistants, those are the people that help clean your teeth. It's important that you get your teeth cleaned.
Yeah.
I think it's once or twice a year you get your teeth cleaned.
Yeah. Well, and what Dr. Butler said, it depends on the condition of your teeth and depends on what's going on in your mouth. But for traditionally or normally healthy people with healthy oral care or healthy mouths twice a year. But you as an individual may need more, need to see the dentist more times than I may need to. Same thing with like the ophthalmologist and going to check your eyes out and all those things. They're like all of that, like holistic health care. Don't leave anything out. Take care of yourself. I know, especially as men, and with that kind of a segue, next week, we're hitting y'all with a men's health panel. We're not gonna tell you who's gonna be on it yet. You're gonna have to find out who's gonna be on the panel. But you know, us two gonna be there. The us's and we's gonna be there. But we're gonna have a good men's health panel to go with that. But the reason why I said that is just, I know me, when I turned 30, when I was around 29, 30, that's when I really started paying attention, or I started hearing more stories, because we're using social media more. So I'm hearing more stories about men in their early 30s dying from heart attacks, like all types of stuff. Men, a man being in his early 30s and impotent. I don't know about y'all, but that's scary, because
Joe, you got to break down what impotent is for some of the people.
For if you don't know what impotent means when the man cannot get an erection. And heart health is connected to penis health and vagina health. So remember, that blood that goes to the penis is pumping from that heart. Heart health is connected to genital health. Understand that. So that's one of the first things that kind of opened up my eyes, because I'm like, you know, young dude, I'm thinking about my heart and my genitals. Got to keep them healthy.
There you go.
But whatever spurs you to making sure that you are healthy, whatever spurs you to make sure that you're taking care of yourself, you're doing what you need to do. And then, once again, stressing it for men. We have to do a better job. I know I had to get on myself. I had to do better. But all of them, we want to make sure we're healthy and we're not dying early anymore. We need to reduce that, cut that back, because we're leaving our women and our children out here, and we're dying early when we can't be doing that.
Right. And even for the dentist. Now, my personal story in the dentist, I'm terrified of the dentist. But you had, it gets me. So it's important to ask questions and let your dentist know, hey, I'm terrified. It's okay. They have different techniques that they can assist you with and let you know what's going on. Don't be afraid. If you feel something in the dentist's office, it's okay to say, hey, I still feel that. Am I supposed to feel that? It's okay to ask these questions. The dentist is here to help you. They're just like your healthcare provider. They, like I said, the dentist, the dental assistant, and the hygienist, they all work together in a team to basically treat your teeth, your oral health, and your gums. Please go back and watch a Healthy Happy Hour that's on our YouTube page and our neighborhood page.
Neighborhood Medical Center.
And just make sure you go back and watch, because you learn a lot of interesting. A lot of people don't understand your tongue holds a lot of bacteria. So go back and watch those videos, because those Healthy Happy Hours kind of spark some of the conversations we have on our podcast for our mind, body, and soul. Because again, like he says, to bring it all back to home, mind, body, and soul. Your mouth is part of your body and your mind and your soul. Everything enters into your body through your face, through your oral cavity. So you got to think of it as that. You don't think about a lot of things in your mouth. Oh, my teeth they look okay. They look white. They good. I don't think I have no cavities, but you look at all that. But it's important to go get it checked out. Just like if your teeth go, how you going to eat? How you going to go on about your way? You can't smile. You know what I'm saying? You can't be like, and you got all these missing teeth or holes in your teeth. So we really want to make sure we take care of them, because guess what? We can fix all those problems if you do have them.
Right.
So it's very important that you visit your dentist regularly. Sometimes you might have to get a referral from your primary care to get to a dentist. Sometimes that works. But also, if you're pregnant women, you got to make sure you see your primary care or your OBGYN first before you can see the dentist. So even though you might have tooth problems and stuff when you're pregnant, remember, you're pregnant for 9 months. That's a long period. So you got to make sure that you get okay and permission from your doctor. Some of you also have to remember that you have to get permission from your doctor if you're on blood thinners, and as well as other medication like blood pressure and things like that, because you can't have can't take certain medications pulling teeth if you're on a blood thinner. because you're going to bleed more frequently. So you got to make sure you get all that taken care of. So your provider does take a part into your health care as well, and they do go hand in hand. But if they ask you for those things, don't just say it's okay. Follow through with their plan of care so we can make sure they treat you the right way.
There you go. That boy speaking that gospel right there.
I know.
Look at him talk. Look at him talk. So
the little tooth.
Right. So, but like he literally just said these things. That's on this PowerPoint slide for those who are listening. So it's saying, make sure that you talk to your dentist about bleeding gums when you brush your teeth. If your teeth hurt when you're chewing gum or eating hot or cold foods, I know I have sensitive teeth. So if you have sores in your mouth, how long does it take those to heal? How often do you have sores? Are you clenching or grinding your teeth? Clenching your jaw, grinding your teeth. And that says this most happens often while sleeping and during times of stress. So paying attention to those things, because all of those affect your oral health. Questions for the dentist. You got to ask your dentist questions too. We're asking everybody questions. If I'm on my healthcare journey and you even look at me, I'm asking you a question. Why? Because it's my right to know. So when should I brush my teeth? How often should I brush my teeth? So according to Dr. Butler, brush your teeth twice a day. Floss before you go to bed. Do your tongue scraping. Use mouthwash. Floss once a day. Floss before bed or even twice a day. But get in there and floss. And figuring out the condition of your mouth so you can take the proper actions as far as brushing. She even talked about if you are brushing your teeth and you scrub your teeth, don't do that because you are compromising the enamel on your teeth. We shouldn't hear you brushing your teeth down the hall. Make sure you're using the right toothpaste. Make sure you're using the right motions and stuff. Discarding your toothbrush once a month, or if you were sick, make sure you're doing all those things. Those are questions that you should go in there. Matter of fact, anything that pop in your mind, it may not even have anything to do directly with dentistry. Just ask the question anyway, and therefore you will be able to get a better understanding of what's going on. So, so this one section is about mental health. So it's about working with your mental health. So see, we've covered working with your primary care physician. We've covered working with your pharmacist. We've covered working with your dentist. Now your mental health provider. It's the mind part of that body and soul, right? So in mental health, for our listeners, mental health refers to the overall mental well-being of a person. This includes a person's mood, emotions, and behavior, right? Many people suffer from some form of mental health condition. Some of the most I know two of the most common is depression and anxiety. Two of the most common and that I've heard about. I studied psychology in school. I have friends who are psychiatrists, who are therapists. I know we're big on mental health, and for all the professionals that I talk to, depression and anxiety are two of the most common mental health illnesses that people deal with on a regular basis. Mental health conditions and or substance abuse issues can make life more challenging. And we see a lot of people who have mental health issues who are on substances. Sometimes the substances help, sometimes they don't help. And if left untreated, mental health conditions can affect a person's ability to take their medicines correctly. Now, I've seen that. We've all seen that. So that mental health provider is very important as well.
Joe, with that, we need to stress in the communities that we live and work in and breathe every day, mental health seems to be a taboo subject.
It is.
It's okay for you to say that you have a mental illness. It's okay for you to discuss that with your healthcare provider because we don't know what's going on inside your mind. You might present that you're okay, but then you're at times, or you're having trouble sleeping, or you get anxious about things,
right.
Or you're freaking out about certain things and can't do things. So it's important that you discuss those things. And we, especially in the African American community, we need to be able to empower and embrace this mental health and help people with it because it is a real illness out there and it's not something we need to sweep under the rug.
Right. But even think about this, like a person's mental health state can be negatively impacted in a split second.
Mm-hmm.
So we hear a lot of times about let's say I am I'm just walking to the store and a shootout happens and I'm so happen to be caught in the middle of the shootout and I get shot. I don't die, but I get shot. So that's going to affect my mental health moving forward. The 4th of July, I may hate the 4th of July from there because I'm always hearing those noises that remind me of a gunshot. Like people's mental health can be impacted. Like certain situations and certain things can happen on a regular basis that can alter a person's mental health. You can be in the wrong place at the wrong time, doing the wrong thing at the wrong time, or doing something that you don't even consider doing wrong. I know people who smoke the wrong joint with the wrong
Mm-hmm.
substance in there, and they have never been the same. So mental health can change on a regular basis. That's why a person, you have to be your own advocate, and those around you that are part of your healthcare team have to understand the best way to advocate for you.
That's right. That's right.
So, mental health, right? So working with your mental health provider, what are the best practices for working with mental health provider?
The best practice is being open on. Well, first thing is showing up. Showing up to your appointments. That's one thing that we really encourage people to do because it does take a journey for you to get to your mental health provider. Our mental health providers consist of like psychiatrists, psychologists, therapists, counselors, and clinical social workers. So those are all the things that go into play with the mental health piece. So it's not just the psychiatrist is like your doctor. He or she is the MD, but they specialize in the mind.
Right.
And so they're the ones that you need to ask all those questions to. The psychologists assist with testing and things like what's going on with you. The therapists and counselors, they're there to talk to help you sort out things and see what they can do. Each type of healthcare provider poses a different education and skill set. So each one of those providers working together helps you form and copes with your mental illness. The healthcare providers will also see and depend on the certain circumstances. So certain things you might just be able to see the mental health counselor for and not have to see the psychiatrist. Or you see the psychiatrist and then you wing your way down to the therapist. And then you stay with the therapist and then you see the psychiatrist once a year because you're on your medication, everything's working, you're following your treatment plan. So those are the things that you know what I'm saying, you have with them. But those are the people that are really there to help you, especially when those times get tough
Yep.
and you getting depressed and down, or you're talking to people in your head, or you're talking so fast and you're moving around more fidgety and jittery more than normal. Those are the things that really can help you out with that is the mental health crew.
Yep. Yep. And being open and honest with your mental health provider, but also being open to learn things about yourself. Like the last bullet point is saying people could have family issues or family history of mental health illnesses or things that happened within the home, the trauma that was experienced growing up or trauma that could have been experienced within the womb. All that matters and all that affects the person's overall mental health state. So within our community, mental health is no longer taboo. Mental health is no longer something that we just chalk it up to crazy people or something. No, mental health is a part of our regular health routine. Start incorporate, just like you go to the doctor to take care of your body, just like you go to the dentist to take care of your mouth, just like you go to the pharmacy to pick up your meds to help your body, you go to the mental health professional to help make sure you have a healthy mental state. If you live in America, guess what? Your mental health has been disturbed by something at some point or another, and we all need to make sure that we take care of our mental health.
That's right.
Especially during these times. So,
right.
So questions for your mental health provider is, what can I expect from therapy? They'll just don't just, because I know a lot of people who, before they even, I know healthcare professionals who don't give mental health a chance because they feel like it won't work. And so for those people, it's like, well, the mental health professional had to go through the same types of training you had to go to. So if you are a nurse who's saying, well, mental health don't help, well, yeah, nursing don't help either, right? Because that's the same mindset. Because you know what you had to go through to gain your skill sets and become a professional at what you're doing. So you mean to tell me as a healthcare professional, you don't understand that with mental health? And so if we have people within the healthcare field thinking that, imagine how people think outside the healthcare field. So that's why we got to get over this hump. Mental healthcare, therapy, counseling, all those things, they work. That's why they exist. Just the same way dentistry works, same way nursing works, same way being a doctor works, the various forms of doctoring, the various forms of nursing, all those different things. Every part of the medical field exists, or the healthcare field exists for a specific reason. Another one is, how often should I come back?
That's right. That's that treatment plan.
Right.
And then you could also say, like, is there anything else I can do in between the visits to help with my mental health concerns or my condition? There's other things that you can do and say, hey, maybe I need to write down, when I get in this mood, I can write down my thoughts and say this and say that and write that down. Different little things to help you, coping mechanisms to help. And that can help you get through what your process is doing. Because, like I say, some of these conditions actually last longer than a few months. You can have these for years, but you got to cope with them. You can deal with them, but you got to be able to cope and go on with your day-to-day life. And like, what symptoms should trigger me to seek help from before my next appointment? Like, if something is going on, I'm taking the medicine, but it's getting worse. I'm getting anxious. I'm getting scared. I'm terrified. I'm seeing things. What point do I need to go get help? What do I need to call? What's my next step? Is there, always be proactive. Find out, do you have an emergency on-call number? Is there something I can do besides just running to the hospital?
Right.
For certain things. But you can go to the hospital and get checked out for your mental health and things like that. But if you're in a chronic state of emergency. But I would always suggest that you try to call your primary care doctor first, because before you get to that extreme state, you got the smaller stages in between there that's building you up to the big blow up. So we want to try to get you before you get to that big blow up with the providers, so they can assist you in keeping it down, so we don't get to that big blow up.
There you go. Ask questions.
Joe, that seems to be the main thing to do, though, is to ask questions. Everything you said and we said seems to mean to ask questions.
There you go. Your healthcare team can help you achieve and maintain your physical, oral, and mental health. Whatever health goals that you have, your healthcare team, it's the job of the healthcare team to help you reach those goals. So
it is.
So that's what we are with this. That's why we wanted to make sure we do this particular one, is making the most of your healthcare visit, so we can have people doing just that. Well, because about a year or two ago, when we came up with this concept of making the most of your healthcare visit, we did a presentation at FAMU within the nursing program, and it was to get community people to come in and realize how important it is for them to understand how they can get the most out of their healthcare visit. You're not just a pawn in this game. You are the main component in this. You are the Neo in the Matrix.
That's right. And we also want you to know, like, when you become 18 and you get ready to go to college, and you go to college, you move away from home, mom and dad shouldn't be making the appointments for you anymore. You need to be able to take the control. You don't understand how many people we came across was like, I don't even know how to make an appointment with you guys. How do I make that appointment? Or like when we doing our outreach education, like, I don't have a doctor here. I got to go all the way home. But guess what? You don't have transportation here, so you got to try to catch the bus. You're not feeling well. It's always important, even if you're in school, to establish care with where you're at. So if any college students out there, it's okay to pick up the phone and call 850-224-2469 and get Neighborhood Medical Center, and we'll be able to, make you a provider or a patient here. But you can still, when you go home, you can still go home. But you have care here while you're here. When you come to a 4-year institution, you're here for about 4 to 8 years. Really depending on if you're going through that master, maybe even 10 if you get into that doctorate. But you need to make sure you have that establishment here, because what if you need a vaccine? What if you need something, but you need it quick? You don't have to go all the way home to Miami or back to Chicago or Tennessee or wherever you're from just to get some vaccines that you need for school down here. You can be able to get it right down here yourself. And like I say, we take most insurances, we take no insurance. So, but every school has to have some type of insurance when you're in school. So that shouldn't be a reason why you're not in school either, is because you don't have the insurance. Insurance is there, but if you don't have the insurance, we do take people without insurance, and we want you to understand you can seek care here in Leon County and the surrounding areas without any type of insurance. So there's no that should not be a reason why you can't make any of your healthcare visits.
Right. That's real. That's real. You taking full responsibility of your care. Parents too. Parents, you all can teach your kids how to take care of their own health, how to set appointments, how to do all those things. Don't just be sending these kids out to college. That's all willy-nilly. They out here just trying to learn on their own. We meet so many of them who don't even know their Social Security number.
Right.
Y'all tripping. So please make sure you helping people to make the most of their healthcare visit. So we do got a couple announcements. So coming up, we have a healthy happy hour that's coming up. It will be Thursday, October 19th at 6 p.m. via Microsoft Teams. We have Mr. Mark Leonard, who is our Chief Information Officer. He's going to stop by our Healthy Happy Hour and talk with us about information technology in healthcare. So that's Thursday, October 19th, and we will begin advertising that ASAP. Of course, every Wednesday we here with Mind Your Body and Soul. The 18th, the actual 18th, if you're in Tallahassee area, 18th, we will be having a food distribution at the Lincoln Neighborhood Center at 438 West Brevard Street. It'll be from 9 to 11. So check our Neighborhood Medical Center Facebook for that, for more information on that, or if you're part of our email list. If you want to get more information, you can email me at jward, JWARD at neighborhoodmedicalcenter.org. You can email Mathias at msweet at neighborhoodmedicalcenter.org to get more information about that. And we have some drive-through COVID testing events that's coming up soon, and we'll make sure we update you all on those dates. For those, we're still getting information together, but we just try to make sure we're doing our part to help take care of our city. Anything you want to add?
Just make sure that you tune into that Healthy Happy Hour key component, because the Healthy Happy Hour this month is about the information technology. He's our CIO. He controls the computer systems, everything. He can answer your questions about HIPAA compliance. Like if you have questions about telehealth, a lot of people are scared to do stuff over the computer because they're scared the information is going to get out. He's the guy to ask and talk to about what's going on with that kind of stuff, because he can kind of assure your mind that everything is safe. We have to make sure that we stay HIPAA compliant, and that's his job, is to make sure that our patient information is secure and sound. So we really want you to understand and check into that Healthy Happy Hour. We really want you to also take advantage of our Mind, Body, and Soul. Like Joe said, each week will be a different topic. So tune in. If there's more topics you want to hear about or anything else, send us a message. Give us a phone call. Telephone number. Joe, what's your work cell number?
56850-567-3322. Hit me up.
And mine's 850-688-0914. You can also leave us messages on Facebook. You can also leave us messages on the website. But if there's something you want to hear or want us to come talk to your church group or some students or some kids or something like that, give us a shout out. We always have information. We're always ready to come out and educate the community. And also, we are providing free food giveaway with partnering with Second Harvest on the 18th of this month. It is some good food. Like it's not no little small little, you get one little box here or there. We load you up with food. And guess what? Thanksgiving's right around the corner. Everybody needs some help at some point in time. Don't be ashamed to come get the food or anything or to stand in line. These services are out here to help us. COVID is here. We know people are struggling and needing help. That's why we're out here doing these type of services. So please feel free to come out to anything that we're having.
Right. Stop calling him, whoever that is. Stop calling him. So, hey, remember, Mind Your Body and Soul, the Healthy Podcast, hosted by myself, Joseph Ward, and Mathias Sweet. Want to give a shout out to our guest host, Mr. Alana Steaple. Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners become the healthiest versions of themselves. Remember that our topics are constructed to inform, uplift, empower, and mobilize our listeners to become the healthiest versions of themselves. Like I just said, I messed the whole thing up, but you get it. You get it. We're available. You can check out our website, our home base, our website at nmcpodcast.com. That's nmcpodcast.com. Make sure you visit the Neighborhood Medical Center website at neighborhoodmedicalcenter.org. We're also available on various podcast platforms, Anchor.fm, Breaker, Radio Public, Pocket Cast, Spotify, and Google Podcasts. So please check us out because we're out here doing
our pages. Please like and share our pages. That's the main thing, so we can get out and get the education across everywhere across the world. We want to be big as we can be. Just help us get out there and spread the word, because if it might not help you, it could help somebody else. Or if it's helping you, help us help somebody else. So that's our main thing. Please like and share and comment and let us know what's going on, what we need to do different, any changes, anything. Just speak to us, talk to us. We're here.
And remember, Joseph and Matthias R&B album is coming soon, so make sure you stay tuned. So that being said, I'm Joseph Matthias Sweet. It's Mind Your Body and Soul.
Y'all take it easy.